Good morning, afternoon, and evening, everyone. My name is Angela Hennis, and today I will be discussing a topic that is gaining increasing attention in maternal health care: home births in the United States. This presentation stems from my recent paper for maternal and newborn nursing, and I'm excited to share some key insights with you. To start, let's consider Taylor. Like many expectant parents, her first hospital birth left her feeling very overwhelmed. For her second child, she's seeking something different, a more personal, comfortable home birth. Taylor's choice reflects a growing trend. A home birth is simply a planned birth in a private home, chosen for a natural, intimate, and less clinical approach to childbirth. This rise in interest isn't just a fleeting trend. It's driven by a desire for more control over the birth experience, a preference for natural methods, and sometimes dissatisfaction with traditional hospital care. When we talk about home births, we're talking about care provided by trained professionals. The primary attendants are midwives. There are two main types: certified nurse midwives, CNMs, who are registered nurses with advanced training, qualified to provide care and prescribe medication, and certified professional midwives, CPMs, who specialize in out-of-hospital births, with their licensing varying by state. You might also hear about doulas. Doulas offer crucial emotional and physical support during home births. But it's very important to remember that they do not provide medical care or deliver babies. Beyond the choice of provider, cost is a significant factor. A planned home birth typically ranges from $3,000 to $7,000 in 2024. This often covers prenatal birth and postpartum care. In stark contrast, hospital births generally cost anywhere from $15,000 to $30,000. So while home births can be more affordable upfront, families should also always budget for potential emergency transfers or unexpected medical needs, as those aren't typically covered in the initial home birth fee. While still a smaller portion of all U.S. births, home births are definitely on the rise. They increased by 12% from 2020 to 2021, reaching 1.41% of all births, the highest rate since 1990. The most current statistics are still pending as well, so that's why there isn't more recent data. This followed an even larger 22% increase from 2019 to 2020, significantly influenced by families seeking to avoid hospital care during the COVID-19 pandemic. It's also important to note that this increase is not just limited to one demographic. From the same time period, home births increased across all racial groups, up 10% for non-Hispanic white women, a notable 21% for non-Hispanic Black women, and 15% for Hispanic women. To put this in perspective, the U.S. home birth rate is significantly lower than in some developed countries. Worldwide, there are many other countries that have a larger home birth rate. For example, in Netherlands, roughly 22% of women have home births, supported by a very organized system that accommodates hospital transfers smoothly. So if there's an emergency, those women can go to the hospital quickly. New Zealand also has a stronger home birth model. Yes, smaller country, but there are 3% of home births there. These international examples highlight that safe home birth is possible with robust, systematic support, and the U.S. needs to still develop this further. The safety of home birth versus hospital birth is a complex and often debated topic. For low-risk pregnancies, planned home births with trained professionals often result in similar outcomes to home births, with the added benefit of fewer medical interventions. However, research findings do vary. For instance, a 2020 study by a man named Grunbaum and colleagues reported a higher infant mortality rate for home births compared to in-hospital midwife births. Conversely, some research, like a Swiss study, found no major outcome differences for low-risk home birth versus hospital birth. It's crucial to emphasize that home births are mainly recommended for low-risk pregnancies. Key risks include 1. Existing high-risk conditions such as diabetes or multiple gestations, and critically, the lack of a clear, efficient hospital transfer plan if unexpected problems arise. Despite these concerns, home births offer clear benefits. Many individuals report greater satisfaction, more control, and the comfort of a familiar setting. They also often experience fewer medical procedures common in hospitals, supporting a more natural birth process. However, accessing these services can be difficult due to regulations, challenging transfer policies, and inconsistent insurance coverages. These issues often worsen existing racial disparities in maternal health outcomes. So what's nursing role in all of this? Well, nurses serve as vital advocates for those choosing a home birth. They empower families by providing evidence-based practice about different birth settings, explaining the risks and benefits for low-risk pregnancies, and helping establish crucial emergency plans if those are needed. Even if hospital nurses do not attend home births directly, they often interact with these patients during prenatal visits, after the baby is born, or if an emergency transfer to the hospital becomes necessary. Additionally, effective teamwork among hospital staff and home birth providers is essential for safer care. Nurses can play a key role in fostering better communication and building trust with community midwives and other providers. When a transfer from home to hospital is needed, nurses are instrumental in ensuring a calm and supportive therapeutic transition. They quickly assess and care for mother and baby while clearly communicating with the home birth team. Then following the birth, nurses continue to support the family's recovery by monitoring health, assisting with breastfeeding, and offering guidance on newborn care. Most importantly, nurses must provide respectful and non-judgmental care, honoring patients' cultural beliefs and birth choices, and always being aware of their own biases. Improving cultural competence leads to a better connection and outcomes. Rise in home birth has significant implications in nursing practice, highlighting areas where a profession can grow. For example, current nursing education primarily focuses on hospital births, but incorporating lessons on home births, risk assessment, and emergency transfer would better prepare future nurses. Nurses also have a powerful voice in policy advocacy. We should support policies that increase access to midwives and home birth care. Organizations like the American College of Nurse Midwives advocate for laws that allow midwives to practice fully and receive fair Medicaid payments. Improving teamwork between home birth and hospital providers is critical. Strong communication and joint training can make transfers much smoother, improving patient safety and experience. Finally, nurses contribute significantly to home birth research and policy. Our direct work with patients provides invaluable insights that can guide safe, patient-centered care and improve access to home birth options. In conclusion, home births in the U.S. are becoming increasingly popular as families seek more personal, less clinical birth experiences. While debates about safety persist for low pregnancies, with proper planning and emergency support, home births can be a safe option. So, as Taylor's story illustrated, this trend is deeply personal for families. Nurses are at the forefront, educating, collaborating, advocating, and providing compassionate care, ultimately helping to make home birth safer and more supportive, no matter where it happens. So thank you from not only my family, but Taylor's family as well.